Hi, I'm Angela Grassi from the PCOS Nutrition Center, and I'm thrilled to introduce my guest today, Judy Simon, who is a dietitian from Seattle, Washington, who specializes in fertility. And today she's going to tell us a little bit about her Food for Fertility program. So Judy, welcome. Thanks for joining me today.
Great. Thanks so much, Angela.
So tell me about your Food for Fertility program.
Yeah, I'd love to share it with you. So about a year ago, I really saw a need to work with women in a group setting, not just individual. And the women that I'm working with in the Food for Fertility program actually have one goal. They're trying to conceive. And they have many barriers, but one that they all have in common is their weight. So all of these women have a body mass index of over 27. They've been working with their physician or a reproductive endocrinologist who's really recommended some lifestyle changes.
Great. So what are some of the topics that you cover in your group?
Well, I try to make the class very real life. These women all vary in their backgrounds. Some like to cook, some have no cooking skills, some eat out all the time. So over the 7 weeks, we work on a variety of topics. But to just step back a little bit, what really helps is I meet with each woman individually before the class starts.
So you assess them.
I do. I assess them, and if I can, their partner also.
Great.
So I've got a really nice feel for what's going on in their home life, what's going on in their work life. They've completed a thorough intake. I know what's going on in their reproductive history. So for example, I may have a woman who is 39 years old. The clock is ticking. She's aware of the impact of her age, and her doctor has told her her BMI has to be under 39. She's feeling a lot of pressure.
Sure.
So having some idea already before the class what her diet's like, I know what her labs are like, I know her medical history. I have a lot of information about her. So this allows me to add a little individualization with each group.
So at the nutrition assessment, is that where you help the patient determine her goals for what she hopes to accomplish during the group?
Absolutely, right. So when we meet together and I have this assessment, we have each woman completes a set of metabolic labs. So I know a lot about her. I know her, glucose tolerance. I know what her lipids are like. I know all her medical history. She's also completed a 3-day food record that has been analyzed online.
Great.
So I know about how she's eating. So I've got some background along with the questionnaire they fill out about lifestyle. So we do a lot of upfront work. And then they've already started to make some changes when they meet with me individually. And when we come to the class, their expectations are not only will they gain more knowledge about how to have a more healthful lifestyle, but they're going to get support from their peers.
Great. That's so important. I bet that's what they, one of the things that they really value about the group.
Absolutely. It's really nice. And what I found for the last 7 years working with women tackling fertility issues is they feel a sense of loneliness and isolation.
Definitely.
They feel like their friends are all getting pregnant and they're not. They're feeling guilty about their weight. They're feeling guilty about, other medical problems that they may have absolutely no control over.
Sure.
So I'm trying to empower these women.
So great.
Right. It's not a strict diet. So you asked me, I'm sorry, a little bit earlier, what are the topics? So we talk about the impact of nutrition and fertility in general, but on a positive note. We talk about having more fruits and veggies in their diet, healthy fats, all that great stuff. Other topics include, we do a lot of meal planning. We work on fast, healthy recipes. And I think one of the favorite topics is kind of food of the week, and I never know what it is. So for example, we'll have kale week where they may get a whole packet of recipes on kale, but then we actually make a massage kale salad, or we cook a soup that we add kale to.
Yum.
And what's really fun, Angela, is that I'll get emails during the week and they'll say, oh, I tried that and it was great,
Awesome.
Or I tried the quinoa. So I think it gives women exposure to foods that they might have read about.
Sure.
They didn't want to try it.
And don't know how to cook it, maybe.
Right. So, we meet actually in the lunchroom of a fertility clinic. So we're very creative in our cooking skills. We do some stovetop cooking and microwave. So I'm very careful about food safety now, but I try to involve the women in the cooking. So like, oh, you cut up the peppers or this or that. And you'd be surprised the things that we may assume as dietitians that women do, they don't always do. So some of them look at me and they say, I'm not sure how to cut up a green pepper. And I'm like, let me show you. So we film in a little cooking skills.
Food prep.
Right. The other fun thing is because we're cooking in class and we're eating real food, it gives us a chance to practice mindful and intuitive eating techniques.
Wonderful. It's such an important part of just enjoying food and
Yes.
getting in touch
Yes.
with your, internal regulation.
Absolutely. So what we'll do is different activities, and sometimes it's even hard to wait till everyone's like dished out their plate. Some of the women, it's a morning class, and sometimes they're really hungry. And they're like, this smells so good, I can't wait. So they may assess how hungry or how full they are during the activity. I challenge them to stop halfway and see where they're
Check
at.
in.
We do some mindfulness exercise where we do some breathing, ways to get centered so that they can practice that, and then they can do it at home during
Take
the week.
it to home and practice it. So you do a lot of, so it's a 7-week program,
Yes.
and you do like food prep, and you do introducing them to food, talking about healthy food. Judy, how does exercise fit into your program?
Good question. In like 3 different ways. One is each week a woman is supposed to set up at least 3 goals. They can be the most basic goals, and they deal with food and activity. So let's say someone is very sedentary, they're not very active. I give everyone a pedometer the first class and a thermoband that they can use for stretching and resistance. So a goal might be, I'm going to wear my pedometer and see how active I am, and then I'm going to try to increase that by 10%. So they're supposed to give me food and activity goals. So that's one way activity plays a role. And then the second way is after the hour-and-a-half class, and I'm starting to call it a 2-hour class, the last half an hour we put on our jackets, no matter what the weather is, we go outside, we're along beautiful Lake Union in Seattle, and we walk for 30 minutes.
Fantastic. After the group is done?
Yeah, we walk together.
Do most of the women stay after
Most
and
do,
walk?
unless they have an appointment or something pressing, or they're not feeling well, some are going through procedures and things. I would say the majority walk, and it's really nice because they get to talk, and they get to relax, and it's beautiful outside. And I'm also trying to show them that no matter what the weather is, even when it's the winter and it's raining, go wear a coat, bring an umbrella, wear comfortable shoes, and we go out and walk. And everyone always feels better after they walk. And we talk about that.
That's
How do you
wonderful.
feel?
That's such an important
And
part.
I always say, look how many steps. You've got 3,000 steps going in. It's Saturday morning. So I think it's modeling the behavior, accountability. And another really nice part of this program is we always start off with sort of a round robin where we go around the table and everyone checks in. It takes about 15 minutes, but everybody has a voice. Everybody checks in, and they talk about something they feel really good about the past week. And then there's always someone, well, last week it seemed like everybody had some challenges. And they talk about their challenges. And what's nice is I'm kind of quiet. I let them process a little bit, and they jump in and help each other. So somebody might say, oh, I didn't have time to get to the store. We had to eat out. And somebody might jump in, oh, I call Amazon Fresh, and I get the groceries delivered. And, it costs a little bit more, but it's less money than eating out. So I kind of let them problem solve and show them, you all have a lot of solutions inside that you can share. And they feel really good about that because they help somebody else.
That's great. What's your average class size?
Good question. I can take up to 12. I have 11 currently. Well, it's about 8 or 9, which is really a comfortable amount. Okay. I'm in my 4th class. We've never had anyone just drop out.
No dropouts.
No dropouts. We
That's
have
impressive.
had, obviously people miss sometimes a class or two for vacation or not feeling well. And one of the most exciting things is that, after a 7-week class, I think in almost every class, someone has conceived during the class.
Get out.
During the class. I ask them to just tell me privately, everything we're eating is fine for first trimester. I just want to know, so I'm making sure they're okay. I do ask them to wait till they're further along in their pregnancy to share, because there's always a chance of miscarriages, which is pretty devastating. But what happened after the 2nd class is, everyone's not pregnant at 7 weeks. They need some more time. So, or they're waiting to get to their weight for an IVF cycle. So we came up with the idea of having a monthly class. It's kind of a support group, same idea. It's an hour and a half.
This is an aftercare, like after they discharge from your 7-week
So after
program?
they finish the 7 weeks, on usually the 4th Saturday, we do the support group, but we really run it in the same way. We still do our food, we do checking in, and then a topic. So for example, the next topic will be all the wonderful scientific findings from the Food and Nutrition Conference and American Society of Reproductive Medicine.
Sure, both important conferences.
And they love it. They love when I bring them science updates.
Yeah.
And that's been kind of a fun topic, and we'll make something. Tend to focus on seasonal foods. So we tried pomegranates the other week. We're big on winter squash and lentils, being fall foods. In the summer, I've done things like grilled veggies, yogurt smoothies.
Fantastic.
It's really fun.
So obviously, you've had some good results with some women getting pregnant.
We have.
What other results have you seen in women?
Well, I just presented an abstract last week at the American Society of Reproductive Medicine. And we saw, in a 7-week period, we saw a significant decrease in their body mass index from going from a BMI of over 37 to closer to 35.
So they're losing weight.
They're losing weight. We aim for a 5% weight loss. And that's a lot easier for someone who's 300 pounds to think, okay, I'm going for 15. Some women might only lose 6 or 7, but here's the important thing. They've changed so many habits. We also encourage them, we can't enforce it, we encourage them to repeat all their labs 2 months later, after the start of the program. And what we're seeing is very positive outcomes. So for example, many of the women have gone to totally normalizing all their labs. Blood sugars are normal, lipids are normal, hormone improvement. And that's a really good sense of accomplishment. Again, it's getting them healthier and it's helping them to get ready to conceive.
That's so fantastic, and it shows the importance of diet and lifestyle as a primary treatment approach for women with PCOS and those who are trying to get pregnant.
And probably I would say the majority, about 90% of the women have PCOS. We don't spend a lot of time, per se, discussing disease pathology. We don't even really talk about their fertility treatments. So it kind of gives them a break from that. And we just focus on the lifestyle, taking care of themselves, self-care, sleep, stress management, nutrition and fitness. Right. Occasionally we try to have a doc stop by, and having their doctor stop in, one of the doctors from the clinic, just validates how important it is.
That's great.
That they're there. I do have a medical director, Dr. Angela Thayer, who's awesome. The clinic I am at, is just wonderful at hosting this program. And we're allowed to have people from other clinics. So they don't just limit it to theirs. They really want to provide a service to the community. So basically, I run the program, which is really nice. And I'm able to talk to them about any issues that may come up. And we haven't had any problems.
Judy, if someone wants to find out more or register for your program, where should they go to get more information? Okay.
If they're in the Seattle area, and I have women driving as far as 2 hours to come to this class, they can contact me at judy@mind-body-nutrition.com. The phone number there is 425-260-8783. That's Mind Body Nutrition. The classes are held in Seattle at the Seattle Reproductive Medicine Clinic. But as I said, I have women that are just in their primary care, or they're at another RE clinic, and it is totally fine. I will work with any of their care providers.
That's fantastic.
Yeah, it is part of the program, though, that they have to see me. I have to meet with them and know what's going on. And I think that's what that adds a lot to the program.
Well, Judy, it's a fantastic program. You're helping so many women. They're so lucky to have you.
Oh, thank you, Angela.
You're such an expert in the field of fertility and PCOS. So thank you so much for joining me today.
Thank you. And thank you for all I've learned from you about PCOS. My patients love your book. They love the workbook. And what's really cool, I need to share with you, is some of the activities we take from both ends of the book. We take some from the nutrition, where we're talking about rises in insulin, great pictures. And we
from
also,
the workbook.
And we also love the activities about mindfulness that the psychologist wrote in your book.
Fantastic.
So it's a great tool. Thank you, Angela.
Well, I'm glad it is helping you. Thank you so much for joining me, Judy.
Thanks, Angela.
And thank you for joining us as well.